Good evening, Representative Comey and members of the committee. It's good to be with you. This evening, my name is Paul Kidwell. I'm here today representing the Connecticut Hospital Association. We've submitted testimony on 12 of the bills before the committee today. I'm happy to speak to any of those, but I'm going to limit my testimony this evening to HB 5041 and SB 3. Related to HB 5041, we respectfully oppose the inclusion of a feasibility study of a public option program within the bill. Although framed as exploratory, such studies frequently serve as precursors to rate setting or reimbursement caps tied to Medicare or other benchmarks. Commercial payment help offset chronic Medicare and Medicaid underpayment and fund critical services. Imposing additional downward pressure on commercial reimbursement through a government-run health insurance plan would further jeopardize access to care, making the problem worse without addressing the drivers of the cost shift, Medicare and Medicaid underpayment. We do support the policies in the bill that assist small businesses in supporting their employees' health care, namely sections 4 and 5 of the bill. Related to SB 3, we strongly support Section 18, which would make several meaningful improvements to prior authorization and utilization review. These reforms respond directly to longstanding concerns CHA has raised with the inappropriate use of utilization management, particularly prior authorization, to delay or restrict access to medically necessary care. We also support sections 16 and 17. As HR 1 is implemented, we encourage the state to adopt an appropriately expansive definition for purposes of determining exemptions from Medicaid work and community engagement requirements. We also support the requirement in section 17 to require DSS to obtain approval from this committee and the Appropriations Committee before changing the Medicaid payment model from a fee-for-service model to managed care or seeking related federal approvals. We support sections 12 through 15, which would establish a formal process for the state to monitor, report on, and disseminate information to beneficiaries regarding eligibility for an exemption from Medicaid community engagement and work requirements. We must respectfully oppose sections 4 through 8. The bill indicates that the Connecticut Option could structurally operate as a plan that looks like Medicaid or mirrors Medicaid. As I noted earlier, we are opposed to any plan design and implementation built on top of the current Medicaid program without addressing the significant deficiencies in it. Namely, Medicaid reimbursement rates do not come close to covering the cost of care. Connecticut hospitals are already operating under significant financial strain. The Office of Health Strategy recently issued a report showing statewide operating margins at 0.2%. Reimbursement from government payers remain well below the cost of care. Our hospitals incur nearly $3 billion in Medicare and Medicaid losses annually. We are also concerned with sections 10 and 11. We do appreciate the committee's continued focus on helping patients manage the cost of care, but have concerns with the financial assistance provisions in these two sections. Although we greatly appreciate the sentiment, we have concerns about conditioning DISH payments on adoption of financial assistance policies. Under federal Medicaid DISH rules, each hospital is subject to a specific DISH limit, and the availability of DISH must be evaluated together with other Medicaid reimbursement, including supplemental payments. As a result, DISH may not be available or available in the same amount for all hospitals that adopt these proposed financial assistance policies. We instead propose that the state consider establishing a dedicated and stable funding pool for hospital uncompensated care payments that is not contingent upon this voluntary financial assistance program. Again, I appreciate the time this evening and happy to answer any of your questions.
Thank you. And how many bills did you say that?
12,
12
I think,
bills.
today.
Okay, we'll have to
We submitted
through.
all the testimony.
And you submitted them separately,
We
which is
we submitted them separately.
a little challenging to go through all at once. So, thank you. Any questions? No. Thank you
for
so
the
much.
time.
No, my hand is up, sorry.
Oh,
Lesser's
Senator
hand is
Lesser.
up.
Yeah, just really quick, I just want to appreciate your testimony. Look forward to continuing to work with CHA on these issues. Thank you.
Thank you, Senator.
Thank you, Senator.
Thank you.
Thank you.